For 60 years, there's been this one kind of obscure committee that has quietly shaped one of the most basic parts of American healthcare, our vaccine schedule. But in 2025, that committee was suddenly and completely transformed. This is the story of the Advisory Committee on Immunization Practices, or ACIP, and how its dramatic overhaul could change public health as we know it.
So, have you ever stopped to think about this? Who actually decides which vaccines we get and when? It's a question that affects every single one of us, right from birth. And for decades, the answer has been a little-known group called the ACIP.
Ever since 1964, this group of outside experts has been the scientific bedrock for U.S. immunization policy. Their recommendations are the ones that guide your pediatrician, they inform parents, and they're even written into federal law. They're a pretty big deal.
All right, so to really get what happened here, we're going to look at the committee's original mission, then dive into the big shakeup in 2025. We'll look at the new roster, see how they're putting policy into practice, and finally, try to figure out what the future might hold for the ACIP.
So let's start at the beginning. How did this committee operate for 60 years? Well, its role and its influence grew pretty steadily, getting embedded deeper and deeper into the nation's public health system.
It all started back in 1964 with the simple mission of providing expert advice. But then, its power grew a lot. Congress put it in charge of the Vaccines for Children program. Then, the Affordable Care Act came along and mandated that insurance companies have to cover its recommended vaccines. And that's the key. Their recommendations became policy, which carries huge financial and public health weight.
So who were the people making these really critical decisions? Well, the committee was built on a foundation of technical expertise. The members were all chosen from outside the government, and they had to be totally free of financial conflicts. That meant no working for vaccine makers, no holding vaccine patents, and they had to file financial disclosures every single year. The whole system was designed to make sure the recommendations were based on science, not on industry influence. So for 60 years, that's how it worked. And then, everything changed. In the summer of 2025, the committee went through a pivot so sudden and so total, it sent absolute shockwaves through the public health world. On June 9th, the news dropped. The Secretary of Health and Human Services, Robert F. Kennedy Jr., dismissed the entire committee, all 17 members, gone, effective immediately. So what was the official reason? It was pretty straightforward. The Secretary said the committee was, quote, plagued by conflicts of interest, and that this move was necessary to restore public trust. But the dismissed members, well, they saw it very differently. One former member said they were shocked that this would fundamentally destabilize vaccination in America. And they pushed back hard on that official reason, saying the committee actually had one of the strictest conflict of interest policies anywhere.
So, with the old committee gone, the question became who would replace them? The answer came surprisingly fast, and it signaled a profoundly new direction for the ACIP.
The difference in the appointment process is just stark. Historically, getting a seat on ACIP was a marathon, not a sprint. It was a long, tough vetting process that could take up to 2 years. In 2025, the new members were announced just days after everyone was let go.
And the new committee's makeup, wow, it reflects a huge shift. You've got people like Dr. Robert Malone, who was an early contributor to mRNA technology, but then became a major critic. You have Dr. Recep Levi, an MIT professor who claimed mRNA vaccines cause serious harm. Then there's Dr. Vicky Pebsworth from one of the country's oldest anti-vaccine groups. And you also have Dr. H. Cody Meissner, a pediatric infectious disease expert who had actually served on the committee before. It's a very different mix.
So you've got a new committee with a very different makeup. How does that translate into actual policy discussions? Well, a recent and pretty contentious meeting on the hepatitis B vaccine gives us a powerful case study.
You could really feel the atmosphere of the meeting in this quote from a new member, Dr. Joseph Hibbelin. He was frustrated, saying the wording of the proposal they were voting on kept changing, making it feel like they were trying to evaluate a moving target.
Now, to get why this debate was so important, you need to know this one number: 99%. That's how much acute hepatitis B infections dropped in kids and young adults by 2019. And it was thanks to the universal birth dose that was recommended way back in 1991. I mean, it's been seen as a massive public health success. So here's the heart of the debate. The long-standing policy sees that birth dose as a critical safety net. Why? Because about 18% of pregnant women aren't screened for Hep B. so the vaccine protects those babies. But some of the new committee members started questioning this. They suggested moving to a more targeted approach, only vaccinating infants whose mothers actually test positive.
This new line of questioning drew some really sharp criticism from the liaison members, the folks who represent professional medical groups. Dr. Jason Goldman from the American College of Physicians pleaded with the committee to respect the science and to stop what he called cherry-picking the data. He even said the whole discussion was a waste of taxpayer money.
This whole hepatitis B debate, it really reveals a committee going through a profound transition. So what in the world does this all mean for the future of U.S. vaccine policy?
Let's just recap the fundamental changes because there are three big ones. First, the membership has shifted from being all technical experts to now including prominent vaccine critics. Second, the process itself has moved from building on existing science to reopening debates on things that were considered settled for a long time. And third, the mission seems to have expanded, with new work groups being formed to review long-approved vaccines and the entire schedule.
So what could all this mean down the road? Well, public health law expert Lawrence Gostin from Georgetown University offered a pretty stark perspective. He fears that a loss of trust in CDC recommendations could reduce vaccine access and ultimately cost lives.
And that leaves us with the central question. After 60 years, the ACIP has been completely remade. With its membership, its process, and its mission all fundamentally changed, how is the public health guidance that affects every single one of us going to evolve? And what will that mean for the future of vaccination in America?